I'm excited to introduce a brand new procedure that we have in our practice called Vertical Restore. Vertical Restore is an evolution of about 10 years worth of procedures that I've been doing to rejuvenate the face, and is specifically focusing on how to bring the face back to where it was before, which ultimately is what everyone wants as they watch their face slip into these changes as time goes on. Primarily it's a procedure aimed to help people prevent the aging process, but also to restore or bring them back to where they were after the aging changes have happened. So as we discuss a little bit more, you'll understand the candidacy, you'll understand how the procedure works and who would benefit from the procedure the most. There is a gravitational or a downward pull of the face over time that suddenly makes the jawline more square. It creates laxity in the neck. It causes the mid-face to run down towards the mouth, where we see deepening of the nasolabial folds, and also in the upper face you start to see some hooding happening in the corners of the eyes and a brow that starts to come down with a little bit of time. The underpinning of the change in facial shape comes from the laxity of the fascia underneath the skin. So the fascia is a layer that basically binds a lot of the facial muscles together, and it starts at the level of the temple and it comes down all the way to the clavicle in the neck. And in the upper portion of the face, we call it the superficial temporal fascia. In the mid-face, it's connected to the SMAS, same thing with the jawline, and in the neck it becomes the platysma. So all these areas are connected together through fascia, and with age, the fascia starts to elongate. And the best way to think about fascia elongation is to think of it as like taking a wad of pizza dough and holding it upside down, and as you can imagine, with time, that dough starts to get longer and longer. That's what's happening to our faces. There's an increase in length of the face as a result of the elongation of the fascia. And what we're doing effectively is wanting to shorten that fascia back up and reposition everything back to where it was. So basically I think about these procedures as a restoration and not a remodel. And that's an important distinction to make. A lot of our procedures that we have available in our toolbox really do change the appearance, and that's why in the communities we see a lot of people that suddenly, they've morphed into something that almost doesn't even quite look human, and certainly doesn't look like themselves. The one thing I always tell my patients, and with a tremendous amount of confidence and reassurance, is that there's no possibility that after they have a vertical restore that they're going to look like a different person. And that's one of the beautiful things about it, is they're going to look like themselves, just a younger version and actually a more familiar version of themselves. So how does vertical restore rejuvenate the face in such a natural way? So one of the things that's so important when it comes to rejuvenation is understanding how the different parts of the face relate to one another. I've never thought of rejuvenation as a singular type of an endeavor. In other words, think about it this way. If somebody has laxity in their jawline and has laxity in their neck, it wouldn't make any sense to take care of the jawline by itself and leave the neck alone. So what ends up happening, and a lot of times, is surgeons will perform beautiful procedures but will not do enough to create the harmony and balance that exists in youth. If you think about it this way, is when we're younger, every part of our face was younger, and as we've aged, every part of our face has gotten older looking. It only makes sense that if you're going to restore somebody back to their younger look, you want to basically combine parts of the procedures in a way that will bring the entire face back into a level of harmony and a balanced rejuvenation, so they look like a younger person as opposed to a blend between younger and older. And so what Vertical Restore does is it combines the key parts of the face that are affected by aging in a way that leaves the face looking completely natural and in a balanced way. So what are those parts? There's the upper segment, which relates to the temple and outer brow area, and it causes the hooding around the eyes. There's a mid-face that starts to deteriorate and start to move downwards so that the nasolabial fold starts to get heavier. and there becomes a little bit of a hollowing underneath the mid-facial crease. And then there's the laxity that leads to jowling in the jawline, which so many of us notice and find a problem. And then there's the final step, which is the laxity that happens in the neck. Now, different necks age in different ways. Some people get heavy in the neck, some people get banding in the neck, but at the end of the day, it's all related to laxity as a primary part of the spectrum. And the reality is that if we're going to restore, we need to go in the opposite direction of aging. So if the neck comes down, we need to go back up. If the mid-face comes down, we need to go back up, and same thing with the jawline and the upper face. So hence the name Vertical Restore is basically a vertical movement of everything back to where it was. And I think that's such an important distinction to make compared to other types of procedures that take the face sideways and you look pulled or you look tight. This gives you a soft, rested rejuvenation and a restoration. The other aspect of it is that it works on the deeper layers of the face. So as a result, it's not a superficial type of an adjustment where you can expect it 6 months or a year worth of change to occur that you see so much with these non-surgical devices like ultrasound devices and different things like that, or thread lifts or lasers. It's not like that, because the level that aging is happening at the deeper tissue layer, the fascia layer. So until we can get in there and reposition everything right back to where it was, you're not going to get a full correction, number one, but B, you're not going to get a long-lasting change. So Vertical Restore is truly a game-changing procedure, and one that I've been so excited about to introduce to our patients through the last year. And I can tell you that of all the things that we've done in the last 10 years in terms of facial rejuvenation procedures, none has had the greatest impact that this particular procedure and the set of procedures combined. So I hope this opportunity to discuss this a little bit more has helped enlighten you, helped inform you, helped educate you in terms of how to deal with the aging process that you're seeing, and hopefully give you some good direction. To get a little bit more information, visit us on our website at drkaram.com. We have lots of information with tons of before and afters, and of course you can call the office and speak to one of our patient coordinators, which will give you some direct one-on-one information. You can send in pictures and further inform yourself and see how your candidacy fits with the procedures that we have to offer.